Hello and good afternoon. Thank you so much for joining the Bloomberg American Health Initiative Addiction and Overdose webinar today. My name is Shannon Jones. I'm the Communications and Events Manager here with the Bloomberg American Health Initiative. Today's webinar will feature one of our Bloomberg fellows, Sarah Danforth, and Sarah is with Prevention Point, and they're based in Pittsburgh. Along with Sarah, will be joined by Faria Zaman, our Fellowship Officer, and Shane Bryan, our Partnership and Engagement Officer. I wanted to go over a few housekeeping notes before we get started. Today's webinar will be recorded. After this webinar, we will send out the link for you to review and share with your colleagues. It'll be sent through the Eventbrite portal, and it'll be posted on the Bloomberg American Health Initiative YouTube channel. This is an audio-only webinar, so we ask that you please mute and disable your devices. And if at any point you have any difficulties or need tech support, please feel free to just type that, whatever the issue is, in the chat pod, and our tech support will be able to assist. Without further ado, I will go ahead and, how could I forget? The most important part of the webinar is this is a Q&A webinar. We will have a session at the end of the presentation for you to ask any questions. If you think of something throughout the presentation, feel free to send those questions in, and we will address those once we finish the presentation. So that is very important, and we look forward to engaging with all of you. So thank you so much for taking your time out to be with us today, and we'll go ahead and get started with our content.
All right. Thank you so much, Shannon, for the introduction. And we have quite a group on today. Thank you all so very much for tuning in to the webinar. This is our final webinar that we have scheduled. We've done many of these and had great opportunities connecting and chatting with folks for the last couple of weeks, maybe a month or so, actually. So we are very excited that you have joined us today and are looking forward to sharing with you all more about the Bloomberg American Health Initiative and our Bloomberg Fellows program. So to get started, the goal that we have set for ourselves here at the Bloomberg American Health Initiative, quite frankly, is to improve the health of the United States. And we know that we can only do this through building true collaborative partnerships across the country, working with fellows and organizations who are on the front lines of health in their community. Now, we got started back in 2016, which happened to be the centennial here at the School of Public Health in Baltimore. And at that time, we had received the first report from 2015 of the life expectancy decline here in the country. That was the first time in many years, and every year since that in 2015, for 3 straight years, we have seen such a decline. First time since 1918 that such a decline has happened here in the country. So we know that putting our resources, our knowledge, and working collaboratively in these 5 focus areas, we strongly believe that we can make a great difference. And those of you who are joining today are likely working in the addiction and overdose realm, and we are looking forward to your questions and to answering any of the questions that you might have. So please do use that chat function to submit any questions for us. All right, so let's get started by looking at our 5 focus areas. As I've mentioned, today we'll be discussing the addiction and overdose focus area, but we also work in adolescent health, obesity in the food systems, the environment, and violence. So all of our work across the initiative falls within these 5 areas. And we take a broad approach to all of them. So as an example, for environment, we are most certainly thinking of air quality and climate change, but also within environment, we're thinking about a community's built environment and how that has an effect on that community. Walkability, access to public transportation. Also within environment, air quality as it relates to young people's learning within the classroom. And so across all 5, addiction, overdose, adolescent health, obesity in the food system, environment, and violence, we are looking through a broad lens through your work in your community as it relates to the initiative. We have 3 cross-cutting themes here that we keep to the forefront of our work, those being equity, evidence, and policy. With equity, we are mindful of being a national initiative and ensuring we're reaching out to communities all across the country, urban, rural, the Midwest, the Deep South, and making sure that we are building opportunities with those communities to join and be a part of our work. Also within equity, thinking about supporting individuals with a variety of lived experiences and backgrounds. Here at the initiative, we have a very unique opportunity through the Bloomberg Fellows Program to support those of you who haven't necessarily thought of or have taken a traditional path to public health. Certainly, your work is influencing and supporting the health of your community, but maybe you haven't done a traditional undergrad in public health or even have been part of the healthcare field. So we're always very excited to connect and support those who have taken the non-traditional track, if you will. Within evidence, it's all about the data. So thinking about how we can support setting up and establishing strong data management systems so that way organizations are using that data to evaluate and enhance their programming. They're using the data to tell their stories, and connected to the next theme, they're using that data to influence policy. For policy as a theme, we think certainly about national, state, and local policies, and in using the data to make policy changes that will affect health. But also, we are thinking about organizational policies and how can we, at the initiative, support organizations to evaluate their policies and ensure that their team or their staff are best connecting and supporting the community. So just a snapshot of how we got here. As I mentioned, the initiative got started back in 2016. Mayor Bloomberg, who is an alum of the school, provided a $300 million gift to get it started. These funds will endow 25 faculty that will support the fellows and organizations. They will be the leaders in working with and developing opportunities to work with community. It will support 50 full tuition scholarships for the MPH program and up to 10 scholarships for the DRPH program. The funds also allow for us to set across our work, and you can see our approach includes research, education, and practice. Really briefly, all of our research projects are within 2 years. Many of them are one-year projects that are impact-based, meaning that the projects have a deliverable such as a toolkit, policy, or program that allows for those opportunities to be transferred from one community to the next. Within practice, that's where the support for our faculty come in, the 5 faculty across the 5 focus areas, 25 in total, along with some of our other work that we do supporting the public sector through consultation projects. But I think what you all are on here today to learn more about and ask us questions. Don't forget to use the chat function to add your questions in. We'll address them at the end of the webinar. But it's to hear more about the educational opportunities for the Bloomberg Fellows Program. So I am pleased to introduce and turn it over to Faria Zaman, who will talk to you more about the Bloomberg Fellows Program.
Thank you, Shane. Good afternoon, everyone. I am excited to tell you about the Bloomberg Fellows Program. So this is a very unique type of scholarship program. It's impact-based, and it targets individuals who are working on the front lines of any of the 5 focus areas. So fellows center their studies in their particular focus area. They engage with their organizations during the course of their MPH program. And once their studies are complete, fellows will serve at least 1 year at their organization, and the organization joins an ongoing network of practice and research with the Bloomberg School of Public Health. Now, the initiative is working really hard to build a very dynamic and diverse network of partnerships. We are trying to recruit a very wide range of both organizations and fellows from both inside and outside the traditional public health world. For example, fellows might come from local governments or police departments, small community-based organizations, housing authorities, school systems, just to name a few possibilities. And the fellowship will recruit 50, that's 50 MPH fellows and 10 DRPH fellows annually. And so fellows can attend the MPH program either full-time or part-time. Full-time is here on the Baltimore campus, and part-time is almost entirely online. And applicants must apply to the fellowship with support from the organization for which they work, and they should be working in one of the 5 focus areas. And as I mentioned, after graduation, fellows do a service obligation, which is they work for their organizations for at least a year following their graduation.
And so here you can see just some of the fellows who are in the addiction and overdose focus area, and they're really coming to us from all over the country and in all different types of organizations. You can see Haven, who's out in Portland working at Outside In, and she's doing really innovative work operating a syringe exchange program, one of the actually one of the first in the country to be publicly funded. But then we have Thaddeus, who is in Hawaii working with the health department, one of our more traditional fellows within public health, doing important work in hepatitis prevention. Allison, who's down in North Carolina, actually works in the chief medical examiner's office and using data from the chief medical examiner's office to inform programs and policies on preventing death. Joseph in Santa Fe is working with an aid service organization and is testing clients for HIV and Hep C and supporting those who have preliminary positive results. And you can certainly see across the board, our fellows are coming to us from a variety of backgrounds, a variety of organizations, and have gotten to their work through a variety of experiences. And we're really excited that we have one such fellow on the line today, Sarah, who, as Shannon mentioned, is at Prevention Point Pittsburgh and is going to share with you all a little bit about her experience and what she has gained thus far as a fellow. And just as a reminder, that chat function is still open, waiting for your questions. Questions can be directed to any of us, and Sarah has shared that she is more than willing to answer any questions that you might have. But now, Sarah, we'd like to turn it over to you for your insights and thoughts that you have on the Fellows Program. Oh, are you there, Sarah?
Nice to hear your voices. Yeah, I would say that hearing your presentation thus far, I probably reflect the more non-traditional student, being, in my early 40s and having had a long and varied career, doing a variety of different sort of social service work, and then landing more in the harm reduction and public health world within the last 5 years. But yeah, what I would say for me, what has made this program really unique is the collaborations that I've had with professors and the relationships that I've built with my classmates and my fellow Bloomberg fellows. And, even if it's just that we've formed, online study groups together to tackle biostatistics or epi in that first year, it's just really been really nice to hear about the work that they're doing and just feel really supported, especially I would say in the work, the field of addiction and overdose, although probably with all of the different focus areas, people, can feel some sort of sense of just overwhelm or just really, tackling huge issues. And I have to say, being a fellow and having my classmates sort of, on this journey with me, I just feel a lot more hopeful and inspired. I'm really able to learn a lot from some of the evidence-based strategies that other fellows are using in their cities. And yeah, I think that that's just a really unique aspect of this program is getting to meet a lot of sort of, classmates and comrades in this particular focus area and really learn from each other.
Great. Thank you so much, Sarah. And, it's great to hear of the experiences that you have had so far. And I'm seeing folks already asking questions. So looking forward to directing those questions to you here at the end of the presentation. So again, thank you so much. And we will be hearing from Sarah more in just a moment, but we'll continue going and sharing a few more information and general application advice as we continue. Here are some of the examples of courses that are offered through the addiction and overdose focus area. You can see a good variety: drug society and policy, health communications, women and substance use, and many others. These courses are developed with our faculty, those experts here at the School of Public Health who are the folks who lead and facilitate these courses for you. Some of the leading minds in this field are here at Johns Hopkins University School of Public Health, and they'll mentor and support you during your time as a fellow. All right, so Faria is going to talk to us a little bit about the full-time and part-time format.
Yes, so as I mentioned, the MPH program can be done both full-time and part-time. So for the full-time format, it is an 11-month experience that requires completing basically 5 8-week terms over an academic year, beginning in June and ending in mid-May. And as you can see from the slide, the summer term begins in late June, and term 1, 2, 3, and 4 go throughout the course of the year, and finally by mid-May you would be able to complete the program in 11 months. And also on a part-time basis, students can complete the MPH degree in roughly 2 to 3 years by taking about 1 to 3 courses per term. And I just want to mention, for the online part-time program, almost all of it can be completed online. Not quite all of it, but mostly.
All right, and beyond the courses that you'll be taking as a fellow, we also provide support to your employer, who we call our collaborating organization. One exciting opportunity is through the Applied Experience Award. This is where you as a fellow have the opportunity to turn your learning in the classroom into an actionable deliverable with your organization. Here are just a few examples: a data assessment project, a public service announcement, assessment around obesity rates are just some of the many examples that we have where fellows have taken the learning in the classroom and applied it with support through a $3,500 Applied Experience Award, and work with faculty and their colleagues to create deliverables, which Sarah has done and maybe can talk to us at the end more about here in just a minute. Another example of ways that we support our organization is hearing what their needs are and connecting them and bridging them to faculty or other opportunities through the network. Either supporting changes to policy or connecting with similar organizations across the country to share or learn from best practices. We are always looking to develop new courses. These courses are informed by the work that you are doing on the ground. Some of our courses that we've developed, some examples of them are here, but we're always bringing on more, particularly as we support additional faculty. They will be able to bring together the learning with your experiences and ensure that you're having a rich experience as a fellow. We provide seminars to all the fellows and anyone at the organization. These seminars are educational opportunities, either be it through leadership, communications, program implementation, and many other topics that we share out through a simulcast system that allows for all of your colleagues to be able to participate. You can participate in person here in Baltimore or log in and ask questions through an online platform, and it's a very engaging way to share in the learning process with your team at your collaborating organization. So I know you all are online today to hear more about how you can apply, and Faria has some good information with you there.
I do, thanks Shane. So I'm happy to tell you that our new application forms are available online right on our website. So how to apply? So there are two parts to applying to the fellowship and the MPH program. One is your MPH application. So you would need to apply to the MPH program through SOFIS, which is the name of the application processing system that the Bloomberg School uses. And through SOFIS, you will submit all of your admissions materials, such as your recommendations, transcripts, etc. And when you go to the MPH program website and you click on Apply, it will take you to the SOFIS website, and then you will have very explicit instructions on how to submit all of your application materials for the MPH program. The other thing you must do is apply to the fellowship program, and that is separate. You would go to the Bloomberg American Health Initiative website and click on fellowship and click on MPH. It will take you to your fellowship application forms. And we have two forms, one for the applicant and one for the organization. And both forms are pretty brief. There are 3 to 4 essay questions on each form. So you download those right on our website, you complete the forms, and then you also submit it right on the website. And so that is separate from your SOFIS application for the MPH. And also want to let you know that we have an early deadline of November 1st to submit your fellowship application and a final deadline of December 1st. And I always tell people to please apply earlier rather than later. The advantage of applying earlier is if by chance something is missed in your SOFIS application, if you apply earlier, you still have a cushion of time to submit anything that might go missing. Whereas if you wait until December 1st, you have no time to submit anything else. So yeah, that in a nutshell is how to apply to the fellowship, and we look forward to your applications.
We certainly do. And so just for a few key takeaways before we jump to your questions, we have many, many great questions so far. Go ahead and use a chat function to share your question, and we will get to them first come, first serve. So make sure you go ahead and add your question in now. But just a few key takeaways before we jump to the questions. All of the work that we do here at the initiative is impact based. We are looking to find solutions that will truly improve the health of our communities all across the country. We recognize that a critical component to our work is training the future leaders to use public health as a tool for their work in their community. And it is through the Bloomberg Fellows program that we are able to work and make changes today, linking with the collaborating organizations, our fellows, and opportunities here at the school. We believe that the 5 focus areas that we have here at the initiative are truly important and vital to change the trajectory of the health of our country. We have a variety of ways for you all to stay connected to our work as you're working on those applications. So our website has a great wealth of information, either be it the research projects that we've worked on or information on all of our fellows. Our great communications team is very active on Twitter at American Health. You can sign up for our newsletter. It's sent out weekly on Fridays, the American Health Dispatch. So make sure you get signed up for that. We have a podcast that we work with communities across the country to share their impact and work in their community. And then finally, our YouTube channel has a wealth of opportunities for learning and sharing knowledge as it relates to the 5 focus areas and the various opportunities here at the school. Our contact information is listed here, our email addresses. Please don't hesitate to reach out to either Faria or myself or anyone on our team to get more information should you have any questions as you're preparing your application. So let's go ahead and jump into some of the questions that we have. If we don't get to your question or fully answer it, please, again, do not hesitate reaching out, and we're more than happy to set up a phone call or discuss further with you. All right, Faria, so the first question we have here is about the DRPH application, and it says, is the school-wide DRPH application evaluated as part of the fellowship application, or is only the fellow application itself considered? If the DRPH application is evaluated, what are the key parts?
Okay, well, thank you, Michael, for your question. So for the DRPH program, when you submit an application, it will go through the normal admissions review process by the DRPH program. They will review your application for admission. And once that's complete, the fellowship program, we have our own separate review process. And we will also review your application. And the most important thing for the fellowship review is your applicant form and your fellowship organization form. We look at those very closely and put the greatest weight on what you and your organization say in the fellowship application forms. We also look at everything you submitted to your in your DRPH application, just to see more of your background, but the greatest weight is placed on your fellowship application forms on the side of the fellowship program.
Another question about the DRPH application, and I think it's something that we can address for both the DRPH and the MPH, but how heavily are GRE scores considered through the application process?
So for the DRPH program, I know that if you have a graduate degree, and I believe a graduate degree is required to apply to the DRPH program, you can waive a GRE score, and the DRPH program will be able to give you more information about waiving. And if you email me, Allison, I'm happy to connect you to the DRPH program. But from the fellowship side, we don't place much weight on your GRE score. We look more closely at your fellowship application.
All right, so a question on the organization. So do some organizations not qualify? How do I know whether my organization does qualify? Do I need to be paid for my services? Do volunteers qualify? All right, so do some organizations not qualify? I mean, I think generally speaking here, we want to make sure that the organization, the work of the organization falls within the five focus areas. So if the organization is doing work in those areas and supporting the health of the community, it would qualify. We don't have requirements on it being nonprofit or governmental or for-profit. We rather just want to ensure that they are doing work within the focus areas. I think if you have questions specifically about the focus area and as it relates to, or excuse me, the organization as it relates to the work we're doing at the initiative, it's probably best to reach out and let us know. We're more than happy to have that conversation with yourself or anyone at the organization. So Faria, do they need to be paid for their service at the organization?
Well, also going back to your first question, Bridget, regarding the organization. So the basic eligibility requirement is that both the fellow and the organization should be based here in the United States and should be working in one of the five focus areas here in the States. So that's just basic eligibility, and that could be any type of organizations. And just to give you some examples, we have police departments and libraries and a lot of non-traditional type of organizations here. You just need to meet those basic eligibility requirements, and it's very wide open. In terms of being paid, and so the applicant should be employed by their organization, and the organization should pay them as they usually do. So that service obligation, which is 1 year following graduation, you would just be paid as you usually are by your organization, which would also be your employer. In terms of volunteering, at this time, the fellowship does not consider volunteers. You do have to be employed by your organization.
All right, so a good question here from Carly. Curious about how open the fellowship program is to approaches to public health issues around addiction and overdose that are considered to be more controversial, such as overdose prevention sites, safe injection facilities, as examples. So Sarah, maybe Sarah, would you mind just telling us a little bit more about the work that you do and as it relates to the addiction and overdose realm? And I think that would be a good way to help answer Carly's question.
Sure, that's a great question. And I can just answer really quickly to say that I have experience looking into other graduate school programs in public health, and I have just been really relieved and so appreciative and so inspired by the innovative, evidence-based approaches that Hopkins really focuses on. I feel like it is a harm reduction mandate amongst all of the addiction and overdose classes in particular, just to really focus on the appropriate language, and really interested in looking at some of the innovative work. Dr. Susan Sherman, one of the faculty associated with the fellows, has published some really great research around the importance of fentanyl test strips, for example. So I think that there is I think that the program really focuses on looking at innovative strategies. And my own work, I work for a needle exchange program, and I felt just nothing but support from like day one, starting at Hopkins, with just support from the faculty, from Josh Sharfstein, about the importance of harm reduction efforts, and really a focus on centering the perspectives of people who use drugs within the larger public health practice and debate. So I think that, yes, there's plenty of room at Johns Hopkins to talk about supervised injection facilities, about the use of including drug user perspectives in the public health work. I hope that answers your question.
I think that's a great answer, Sarah. So thank you so much for sharing your perspective. And actually, the next question is, I think, could also be answered by your experiences. Are any of the former fellows or current fellows in this focus area providing direct service?
Yes, I am a direct service. I drive a needle exchange van. I do outreach. I'm, at homeless camps. I'm out there in it talking with people. And what I really love is the way that I can do my direct service work, which is just something that I do pretty well, I think, and it's my background. And then I can also look at things from a larger lens, and I get a lot of education and just a lot of experience of, okay, so how would I take my sort of personal passion around working directly with people and apply that at a larger policy level. And I think that the fellowship program has given me a lot of experience in both realms.
Thank you so much, Sarah. And we do have many fellows here at the Bloomberg American Health Initiative that are, quite frankly, on the front lines of this work. We also have fellows who are more in administrative roles, but it is, we are always very excited to support those who are directly working with community and individuals focusing and facing these various issues. Question for you, Faria, do we need to take the GRE?
Yes, we do need to take the GRE. It is required by the MPH program. However, if you already have a graduate degree, I know there is an option to waive it. However, the MPH program does say that if you choose to waive taking the GRE, it may put you at a disadvantage against candidates who have taken the GRE. And if you want to know a little bit more about GRE expectations by the MPH program, please email me and I will put you in touch directly with the MPH program to get more details about the GRE and the kinds of scores they're looking for.
Another question is about the service requirement. Are you required to work with the same organization for 1 year after graduation? And what if you move on to another job that is still in the realm of substance use?
So you are required to fulfill the service obligation, which is working with your organization for at least a year following graduation. Now, the fellowship does expect its fellows to continue working with their organization at least for that 1 year service obligation. If a situation arises during the course of a fellow's studies where they are no longer with their organization for whatever reason, they would need to inform the school and the initiative immediately, and we would do our best to try and work something out. But the initiative does expect fellows to continue with their organization for at least a year following graduation.
Thank you. Anna, this is a really great question. A lot of the folks that we're looking to support are not taking the traditional health or traditional track to public health. So Anna's question is that she works in the field, but her undergraduate work was not in the field of public health. And she's seeing that college level biology is a requirement for the application. So how would we recommend to applicants who did not do a science undergrad degree to approach this requirement?
Okay, well, Anna, that is a great question. So the MPH program does have certain prerequisites, and one of them is biology. And so the MPH program, for people who need to fulfill these prerequisites, a lot of times they suggest the applicant to take that course at a community college during the process of their application, because they do have to fulfill those in order to apply to the MPH program. Now, if you send me an email, I will put you in touch with the MPH program so you could talk more about the prerequisites and find out what it is that you need and how you can go about fulfilling these as you prepare your application for the MPH program.
Faria, does the DR, with it as it relates to the DRPH fellows, is there a specific number of addiction overdose fellows that will be allocated? Could it be more or less than 2? Or?
No, so we don't have a specific number of fellows for each of the 5 focus areas. We don't take 2 here or 3 here or nothing like that. It's really based on, the applications that we get and who we think would be the best fit for the fellowship program. So there isn't a limit or anything like that for either the MPH or the DRPH.
For the DRPH application, would applicants identify an advisor during the application process? Do you know that one, Faria?
Advisor. Well, you don't have to identify an advisor when you apply to the DRPH program or the MPH program for that matter. Once an applicant is admitted and they are matriculated into the program, then afterwards, the student is assigned an advisor, whether that's DRPH or MPH.
Yeah, and another thing I would add to that question is the faculty are all listed. There's a great faculty directory online, and it's always advised to reach out to the faculty. Their contact information is there for that purpose, should you see a faculty that aligns to your interests. Great question, Stephanie. So Stephanie works for the Department of Health, and their funding is heavily based on grants. Will funding flux be of concern regarding the 1-year post-graduation requirement? It's not of concern to us. It is obviously of concern, but we don't take that into consideration when selecting fellows. Rather, we know and recognize that you and the organization are intending to have that relationship and work together should something happen funding related. As Faria has already mentioned, you would notify the school right away, and we will support and find and do our best to connect you to similar work with a similar type of organization. Anything else to add to that, Faria?
No, you summed it up nicely, Shane. Thanks.
So are managers or directors working in for-profit substance use organizations, opioid treatment programs, outpatient programs, residential programs, welcome to apply?
Yes, absolutely, Andre. They are more than welcome to apply. We don't have any restrictions of whether an organization is profit or nonprofit, as long as they are based here in the U.S. and working in one of the 5 focus areas. Everyone is welcome to apply.
And Stephanie, I see a follow-up to your original question as it relates to grant funding, and your direct work might shift slightly based on the grant requirements. Again, that's completely fine and understandable. Oftentimes, fellows' work will shift throughout their term as a student and during that service year. So no problem there at all. All right, JR has a question. When are fellowship decisions expected to be made after the deadline to apply? And also, if someone were not to be selected for a fellowship, could they still attend the School of Public Health as a standalone MPH degree?
Okay, so the fellowship decisions are made in early March. So we notify our fellowship applicants in and around the first week of March of our final decisions. And if someone applied for both the fellowship and the MPH, did not get the fellowship but was admitted to the MPH program, I mean, they're free to attend the program. It would be up to them to find funding to support themselves.
The application says that we can use a GMAT score or MCAT score. Got it. So we can be in the process of the bio course while applying. That's absolutely correct, Anna. You can be working on that prerequisite as you apply for the program. Just got to complete it before you matriculate and start your courses. Are you required to work for your organization while attending school? Great question, Rose.
So Rose, the majority of our fellows are part-time, and so they do the MPH program part-time. They continue working with their organizations on a full-time basis, and then they have that 1-year service obligation following graduation. And for our full-time fellows, we have very few full-time fellows. Right now we have 5 of them, and so they take a leave of absence from their jobs and they do the program here for 11 months full time. They still have that service obligation for at least a year following graduation. And although they have taken leave to do the program full time, they are still connected with their organizations. For example, their practicum and capstone projects have to be with their organizations. So they maintain that ongoing connection even though they have taken leave for 11 months.
Is work on opioids preferred or even required it says for the DRPH fellowship focus, but generally speaking, no, for MPH or DRPH, preference or work in opioids is not required. Any of your work related to addiction and overdose would certainly be acceptable and evaluated as we are working in this particular area. So stigma, discrimination, change in criminal justice approaches, greater use of effective treatments, all of these types of topics would fit within the realm of addiction and overdose. Now, we certainly do have a focus on, but not requirement, around opioids because of what is currently happening here in our country with overdose deaths skyrocketing, particularly as it relates to fentanyl, but not a requirement that your work is within opioids. Can you use the classes? Let's see, can you use the classes from the MPH or DRPH in the private sector? I think, yeah. All of the it's not solely focused on work in the public sector. We believe that the lens of public health should and can be used in all fields and career types. So hopefully that answers your question, Andre. If not, please do reach out. We're more than happy to further discuss that with you. All right, does the program accept 10 fellows per category or 10 total across each type of focus area? So for the DRPH program, it's up to 10 DRPH fellows annually. So we brought in 8 this year, but we can have up to 10 DRPH fellows, and it doesn't mean any particular fellow of any particular focus area. So not 40, not 10 across each, not 2 in each, but 10 total DRPH fellows. What are the most important characteristics of someone who is selected as a fellow, and what makes a candidate stand out? Great question.
Yes, thanks, Michael, for your question. So, as I mentioned, we place the greatest weight on the fellowship applicant and collaborating organization form. And, we expect that both the applicant and the organization form would be equally strong. And we're looking for people who have a demonstrated track record in their particular focus area and have a commitment and passion for the work that they're doing and to continue that work, their potential to make a difference in their communities, and how supportive the organization is. We want the organization in the application to talk about the applicant, the work that they're doing, the difference they're making in the community, and also the potential they have to make even a greater impact once they finish their MPH studies. So the more that you and your organization talk about your work, potential, difference, the stronger your application will be. And as I mentioned, it's also very important that the organization puts out a very strong support for the applicant.
Great. So for those who are interested in the DRPH program, a question: does a thesis proposal have to be developed before applying?
So no, if you apply to the DRPH program, you don't have to have a thesis proposal, as part of your application. That's not required.
Bridget's question is their interest is in health literacy, and which of the 5 areas would it fit?
Well, I think it would be helpful, Bridget, if we knew a little bit more about what you mean by health literacy.
Yeah, and so we're more than happy, Bridget, if you want to directly reach out to us and have that conversation.
Yeah.
Because I think across all 5 focus areas, health literacy is incredibly important. But maybe as it relates to if there's something around obesity and learning and understanding the risks and how we can change that.
Yeah, and Bridget, feel free to email. You have our emails on the last slide, and happy to know a little bit more about the kind of work that you're doing, and we can talk about how that would fit into one of the 5 focus areas.
All right. So who should complete the collaborating organization form? This is a wonderful question. And the person that's completing that form should know you and your work. It is important that they can demonstrate your commitment and expertise, because that's what we're looking for. But they also should be able to speak to the work that the organization does in relation to that focus area as well. So it does not need to be a direct supervisor or a CEO. It should be the person that completes the application should know you, be able to speak to how great and wonderful of an applicant that you are, along with the work that you all are doing through the organization in the community. What kind of projects are fellows expected to work on in the organization upon graduating? And that's really going to be specific, I think, Faria, to the type of work that they do.
Yeah, so Andre, we don't dictate or expect fellows to work on a specific project for your service obligation. We just expect you to continue doing your work in the addiction and overdose focus area, but we don't say, it has to be a particular project. That's up to you and your organization.
All right, folks. So we have reached the end of the questions that have been submitted thus far. And we are entirely grateful for your participation in this webinar. We're excited to connect with you. We hope that you have found this webinar to be helpful as you're preparing your application. Please do remember that the application deadline, early deadline is November 1st. The absolute final deadline is December the 1st. So you have plenty of time to get all of your materials prepared and submitted. Again, our contact information is on your screen. Please don't hesitate to reach out. I see we have a couple of call-in listeners. So those of you who are calling in, my email address is shane.bryan@jhu.edu. Faria's email is fzaman, F-Z-A-M-A-N, the number 2, at jhu.edu. Please do not hesitate reaching out, letting us know what your questions are and how we can support you or your organization in the application process. So with that, we do thank you all for your time. Don't hesitate in reaching out, and enjoy the rest of your week, and happy application season. Bye-bye.